Today's conversation could open new ways of exercising up to you and give you the confidence to do it. That's because too many women are putting off strength training and popular cardiovascular exercises like rebounding out of fear of leaking or pressure. And the shocking thing, as you'll hear, is that the issue affects a large number of teenagers and younger people too. So in this episode, we're exploring what's happening and what we can do about it with physical therapist Dr. Rebecca Maidansky from Austin, Texas, who specializes in helping women rebuild core strength. Doing that can open up new ways to exercise, which we'll discuss today, and compare how the trend of rebounding using a mini trampoline compares with plain old jumping and which might suit you best. I started our conversation by asking Dr. Becky what we really mean when we talk about the core and the kind of factors that can lead to it breaking down.
Yeah, so when most people think about their core, they imagine their abdominal muscles. They're picturing their rectus abdominis, which are your six-pack muscles, maybe your obliques, which are your rotational and side bending muscles. And then there's a deeper layer called the transverse abdominis. It's like a corset. Those are the muscles that come to mind when people say core, even if they don't know the muscle layers of the abdominal wall, they're still thinking abs. But functionally, your core, think about the core as a can of soda rather than, just a single wall, a sheet of abs. So your core is your abdominal wall in the front, your diaphragm, your primary muscle of respiration on the top, your spine and your spinal stabilizers along the back. And then underneath all of that is your pelvic floor. And those four walls function together to form your functional core, to create stability around your trunk and your spine, to create postural stability, to protect your organs. Those are the roles of the core, and it takes all four of those sides in order to do that effectively.
Why does it matter in terms of as we age, what happens to us along the way?
Yeah, well, I think to answer that question, we first need to understand why it matters in the first place, right? Like, what is it about that soda canister that creates stability in the trunk and in the body? And there is something called intra-abdominal pressure. It's pressure within the abdomen. And as you breathe and as your muscles engage, as you move through life, that intra-abdominal pressure goes up and down. That's natural. The pressure is actually a big way that we stabilize the spine and create that stability around the trunk. But for people with uteruses, as we age, there are certain inflection points in life that can impact the abdominal wall or the pelvic floor that can increase the risk factor for a number of common pelvic floor conditions. So that's why we care. And that's why pregnancy and menopause are these two really common areas where you hear pelvic floor physical therapists chiming in, because both of those times in life, both pregnancy and menopause, create hormonal shifts, create physical stressors, create changes to activity levels, create new stress, changes in nutrition that can impact your pelvic health and your core health.
Now, as I mentioned at the start, you might assume that the problem of urinary leaking only appears after childbirth or with age, but even teenagers can experience it, and in larger numbers than many of us realized.
And it is true, yes, folks need to work on it as they age, but also I think there's still this kind of misconception that pelvic floor symptoms are reserved for pregnancy and for older folks. And in my practice, I see teenagers with leakage and teenagers with painful tampon insertion and urinary
Right.
urgency and frequency. And so I think
Oh,
we would be remiss to not note that a lot of folks in their 40s, 50s, 60s experiencing pelvic floor symptoms have been navigating these for 20, 30, 40 years.
I had not heard of teenagers with urinary incontinence. That's such a young age to deal with something like that, to be carrying that with
Yeah,
you. What a shame, yeah.
young girls in high school and college are leaking in epic proportions when it comes to athletics. Like in certain cases, 30 to 50% of young athletes experience leakage. So it's very, very common. And I think that when you talk to older women about the symptoms that they're experiencing, a lot of times they'll say, like, oh, yeah, I've been having that forever. Like, I just thought I always leaked when I laughed. That's what I hear in my practice all the time.
Wow. Well, do you know what? I think there's probably a lot of people listening that will be comforted by that and thinking it's not just them. It's actually really common
Yeah.
and from a young age. I mean, we're going to come on to some of the things that we can do, and also for those of us who are training, we're lifting weights and so on, what we can do to protect our pelvic floor as we do that. But the impact of losing strength in our core, is it just as you described? And I'm thinking in particular of somebody like my mum, who a lot of my viewers and listeners will be familiar with, who has lost about 85% of the muscle. I mean, she's rebuilding it now. Lost 85% of the muscle in her lower back. So had
Hmm.
no strength in her core and in the back, but had strength in her arms and legs. And you think, why why is this happening? And why the core aging and losing muscles so much more dramatically than the limbs? Is that something you see quite often in women?
That's a good question. I don't know that in my clinical experience, I have seen people come in with really weak cores and really strong everywhere else. If you are moving through life and you're not actively engaging your core when you should be, right? Which isn't all the time, but your core isn't actively engaging when you should be because you maybe lack the coordination. So your body doesn't have the automaticity to use your core as it should be working. But I mean, like, you're still lifting grocery bags, right? You're maintaining functional strength in these other places just by moving through your life. But I mean, let's use your mom for an example. Let's say your mom was pregnant, your mom gave birth. She, I assume, just based on when that must have been, was told, like, all right, you're good to go, 6 weeks, do whatever you want. It wasn't really given any guidance, right?
Mm.
Your abdominal muscles, and and I'm using pregnancy because it is such a common inflection point for people. It's not the only inflection point for women where the core is affected. Any sort of abdominal surgery can do this. Any sort of, I mean, endometriosis, right? There are a ton of conditions that can lead to kind of like a lack of activation in the core. So your mom gives birth. She's told, after months and months of pregnancy, after birth, whether it's vaginal or cesarean, she's told 6 weeks later, see you later, you're all good, come back next year for your annual. And then she continues moving through life, and she continues picking you up when you're a toddler, and she continues chasing you around on her feet, and she continues carting your car seat and your stroller places. And then as you get older, she's packing your backpack, and she's maybe she likes to be active, so she's also outside and she's moving around, but she's never rehabilitated her core.
Hmm.
Then as you age, you're able to maintain strength in these other places, but those muscles, you were never taught how to re-engage them. They never rehabilitated from pregnancy. So that is not true in all cases. It's not like everybody needs this extensive rehabilitation, but people have a lot of beliefs around what their abs are supposed to be doing. There are people that suck them in all the time. There are people that hold them stiff all the time. There are people that don't know how to use them, that overuse them. I think there's a lot of stuff socially and culturally around what's going on in the midsection. And so we see it's not uncommon for somebody to come in with back pain because of substantial core weakness when they're older. But I don't think it's necessarily because those muscles get weaker in a faster capacity than other muscles.
So do you think that every woman after pregnancy should be going through physio?
Oh, I mean, absolutely. Like 100%. There is not an orthopedic surgery that people don't get rehabilitation for afterwards. We know that once a body has gone through some sort of traumatic event, the muscles become inhibited, and then it takes a lot of time for them to recover. And when you're talking about pregnancy and postpartum recovery, I mean, we're talking about months of strain followed by birth, which is trauma, regardless of how the birth is done, right? And then you go into taking care of a newborn, not sleeping, not eating normally, your activity level has changed. So, yes, I think every single person would benefit from postpartum rehabilitation. It's not realistic for a lot of people. There's a lot of hurdles to access. So that's why
Yeah.
we're not seeing it happen. And I don't think that we will, at least not for a very long time. But yes, I think that every single person who's been pregnant, even if it's been 20 years, would benefit from a pelvic floor assessment to see what's going on in the core canister. Are these muscles functioning optimally? And is your bladder, bowel, or sexual function affected in any way, or your athletic performance?
So, how do we actually rebuild that strength safely? And can we really improve it even decades on?
Well, I was gonna say it does tie really well into what people maybe should or shouldn't be doing because it that's like the number one question I think all pelvic floor PTs do or get is what should people be doing? And the answer is like it totally depends. It totally depends. Are you weak and well coordinated? In which case maybe you need to be doing strengthening. Are you tight and you're unable to relax? In which case you need to be learning to fully let go of these muscles. And most often people are somewhere in between that spectrum. So generally what I recommend is being active is really, really important for us as we age, right? For all sorts of reasons, not just for pelvic health, for cardiovascular health, for fall prevention, for bone density, right? It's like generally, I recommend that people continue to do whatever activity it is that they're doing. There is no good or bad activity for your pelvic floor and for pelvic health. Running isn't good or bad, weightlifting isn't good or bad. It's just activity is what's good. And then if you
Mm.
develop pelvic floor symptoms at any point in time, if you develop urinary incontinence, heaviness in the pelvis or symptoms of prolapse, tailbone pain, urinary urgency or frequency pain with sex, then I think that the my most honest response is if you can see a pelvic floor physical therapist for an assessment, start there so that you can figure out what's happening with your pelvic floor so that you can
Yeah.
continue getting all the benefits of the activity that you're doing, but tweak your programming in order to also bring your pelvic health up to speed.
Yeah. Because I interviewed a lady, oh, a good few months back now, who had had pelvic organ prolapse after birth. You know, young woman, and she was a Pilates instructor, and she was really suffering, really struggling, and
Mm-hmm.
figured out through, following people like you and others, a sort of set of exercises that she did and breathing techniques and so on. And she's really got
Mm-hmm.
herself into a better situation. But I kind of discussed with her my own diagnosis because years back, I was diagnosed with a stage 2 rectocell. Um, and just that was
Mm-hmm.
utter misery. You just feel something dragging down there. It's like, oh, what is this? That was kind of in my later 30s. But the humble Kegel, I mean, done properly, was, I mean, I can't imagine life without doing that. That seems to be particularly for my own scenario, something that really, really helps. Um, I mean, I had emergency surgery after
Yeah.
childbirth because a doctor was sewing up when he was doing my stitches, nicked an artery and didn't realize. And it was a, full-blown
I'm
emergency.
so
And
sorry.
during that surgery, I think some muscle was cut away and it has left me with weakness on the left side that I don't think I've ever really had properly investigated. But certainly, Kegels, as part of my overall training program, have made a big difference to me. Does that tally with what you see? Because some people are say, oh well, it's more about breathing and not so much about the Kegels. But how beneficial do you think they
Yeah,
are?
it totally depends, right? So, pelvic organ prolapse, for anybody listening who isn't familiar with it, is when the ligaments supporting your organs become stretched. And so the organ itself sits lower in the pelvis, which means that your pelvic floor has to do more from underneath to support and lift the organ up. So, in that case, pelvic floor strength becomes really important because it's doing the work that the ligament isn't capable of doing. So if you have true muscle weakness and you have true pelvic floor organ prolapse with stretched ligaments, then yeah, absolutely, we need to strengthen the pelvic floor. Now,
Hmm.
Kegels can and often are part of that. Often we'll
Hmm.
need to progress beyond just Kegels and make sure that we're now adding weights, adding glute strengthening, core
Yeah.
strengthening, and inner thigh strengthening, strengthening all the muscles that work alongside the pelvic floor to support your pelvis. But yeah, in that case, absolutely. I don't think that diaphragmatic deep belly breathing is going to be the solution, right? Sometimes we need to
Yeah.
directly strengthen the muscle that's weak. Versus if we're talking about somebody who say had a perineal tear during birth and has maybe always had pain with sex and maybe has vaginismus, which is a condition where the pelvic floor muscles are flexibly spasmed. So tampon insertion doesn't feel good. No insertion feels good. That person doing Kegels will feel substantially worse. Their symptoms will get
Right.
aggravated over time. Their pain will likely get worse. They will not see the kinds of improvements that you have experienced. And there are folks with both, right? There are folks who've had this chronic tension and this tightness and this sensitivity in the pelvic floor muscles that now have prolapse. And what do we do with them, right? They need a more balanced approach. And so that's where there's no one right answer. You'll see on social media people really hating on Kegels, and that's not right either. It's a muscle contraction. It's a tool. If you had shoulder
Yeah.
pain, maybe one person would need to do a lot of bicep contractions while the other person wouldn't, right? Because maybe a weak bicep for them isn't the root cause of their shoulder pain. Your pelvic floor symptoms will work the same way. But I'm glad to hear that they helped you because they are a really effective tool for some people.
Yeah, massively. But I was interested in what you said earlier that when you ask somebody to do them, that some people can't, or have never done that before. There is definitely a sort of it starts with the awareness, doesn't it?
Right.
And there is a particular technique that kind of evolves over time to really get the best out of them, I think. But I mean, everything you were saying points to if people can even try to afford one or two consultations with a specialist, because it sounds like there is no one singular piece of advice that you can offer all of us, say, do this and it's going to work like
Right.
magic.
Right. But if you can determine kind of what side of the spectrum you fall on, are you tight? Are you weak? Are you coordinated? Then I think it becomes a lot easier to wade your way through all the advice online. Like, okay, I'm weak and I can coordinate these muscles well. I just need to get stronger. Like, I just need to start working out, right? Versus, no, I have more tension. I need to explore a pelvic wand and maybe dilators and maybe suppositories for muscle relaxation. But yes, I agree. I think if possible, seeing a pelvic floor physical therapist for even a single visit can give you a lot of information about your body and help you more effectively wade through what's out there.
Are there some basic movements that you would recommend for most women, basically? I mean, we think about the classic bridge. That's something I do, and I incorporate a Kegel with that bridge. That seems to work incredibly well for me in my own situation. But are there a few exercises you think, well, I think most people should probably be doing this after childbirth and menopause years and so on?
Yeah, it's so hard because of everything that we've talked about. And there people will often ask for like, what are the five movements for prolapse or what are the five movements? And the answer is like the solution for pelvic floor weakness is being strong. And there are no three
Yes.
movements that are going to get you perfectly strong, right? We know that strength training requires progressive resistance and strengthening all of the muscles, so different movements. And then there's the concept of muscle confusion, right? We want your body to be moving in different ways so that you're strong in all planes. If we're talking about somebody who has just given birth, yes, I can say like there are a few things that I think everybody would benefit from who have just given birth. If we're talking about somebody who is, say, post-menopause, who has just started to kind of grow awareness of their pelvic floor, then there are some awareness-based exercises that we can incorporate, which I'm happy to talk through. But there's no like do bridges, leg lifts, and squats, and you'll be good because we don't know what your pelvic floor is doing. And what the research shows us is if you have good coordination in your pelvic floor, strength training will make your pelvic floor stronger. But if you don't, strength training can make your pelvic floor weaker. And so I'm always very hesitant to blanket recommend anything to anybody,
Yeah.
besides just saying that movement is good. So for our people who are, say, newly postpartum, I think every postpartum person would benefit from some, and I'm talking like not, this is not the solution to the symptom, this is the starting point. I think all postpartum people benefit from some glute activation, some core activation, and some pelvic floor relaxation. So if we want to simplify that into movements, we could say bridges, great way to get just glute activation. We can say maybe supine marches, so laying on your back, core engaged, just marching one knee off the floor at a time to feel your core
Okay.
activate is a really good way to just gently turn on the core. And then maybe some deep belly breathing so that you can start working on feeling your pelvic floor relax as you inhale and then lift a little bit as you exhale. So just kind of general awareness and activation around the pelvis. And I think for folks who are in this kind of like post menopause or even like going through menopause, feel like their pelvic health is kind of changing, those are good places to start. Glute
Yeah.
activation, core activation, and pelvic floor relaxation, I think will rarely lead anybody wrong unless those exercises make you feel worse, in which case, don't do them.
Finally, I was really keen to talk to Dr. Becky about something that I get asked to look into a lot and which has become incredibly popular, and that's rebounding, a lower impact form of jumping exercise using a mini trampoline that challenges balance, coordination, and cardiovascular fitness while putting less stress on joints than running or hard surface jumping. It's even backed by NASA as an efficient way to improve fitness fast. So, we discussed what the evidence really says and how it compares to just jumping or hopping for bone health and fitness.
From a pelvic floor standpoint, if you look at the rates of urinary incontinence amongst different athletes, trampolining is the highest. There's a study that found 80% of trampolining athletes will have leakage. So, rebounding and trampoline is not quite, I mean, a rebounder is a trampoline, but it's not quite the same thing. When we're thinking trampoline and leaking and athletics, though it's not clearly defined in these studies, I'm picturing gymnasts who are jumping really high and really hard versus rebounding. Usually you're holding on, right? And
Yeah,
the level of impact isn't as severe. But that's one consideration that I have in my mind, right? Is what's it doing to your pelvic floor? And then
yeah,
beyond that, I actually think from a balance and a stability standpoint, it would be an excellent exercise if you can tolerate it because it's going to work all of those little muscles and stabilizers around your hip. You're going to get impact without what you're going to get a lighter form of impact, but still impact, which is great for bone density, good for muscle building, good for cardio. It's a fun way to build both strength, endurance, and cardiovascular endurance. So I'm for it if it's well tolerated, but I wouldn't be sure. I've never seen a study looking at the rates of pelvic floor symptoms with rebounding. But if somebody
yeah.
was having them, then I would recommend that again, they either see a pelvic floor PT or can they reduce the amount of time they're spending on them on the piece of equipment? Can they do maybe half of their workout on a rebounder, half of their workout doing something else, and then slowly build up tolerance?
I mean, I hop actually, based on some of the good studies around jumping for bone density and impact. Jumping on a bad day could challenge my pelvic floor, so I find hopping a lot easier actually, just as
Mm-hmm.
in for the pelvic floor because you're only really operating one side at a time. It saves money on the trampoline, right? When you're just jumping or hopping.
Yeah.
But for some people with that level of impact, if they were particularly vulnerable to fractures or something like that through osteoporosis, is that another thing to sort of consider when you're weighing up whether you want to do rebounding or hopping or jumping?
I think if you are older and you are just getting into physical activity, then I would recommend starting with low impact. Anybody who's starting to move from a sedentary place should be start with walking or start with a walking program. If you're worried about
Yeah,
bone density, I think it's something that they need to speak to their medical provider about. If we're worried about osteoporosis to the level that hopping could create a fracture, then I think that they need much more extensive medical guidance. But
yes,
as far as reducing impact for older folks who want to participate in impact, if the trampoline feels good, then absolutely, it's a great option. However, you can reduce impact by jumping, say, on carpet or grass or a track instead of on concrete or asphalt. So there are other ways to reduce the intensity of the impact. And resistance training and strength training has also been shown to improve bone density. What
yeah.
improves bone density is stress on the bone. And so you can get that by lifting, you can get that by jumping. There's a researcher who just posted something on Instagram recently, and she was comparing different types of exercise and their impact on bone density. And what her analysis was that all of these things increase bone density, and there's no clear like this does it better than that. It's just being active improves bone density. So I would say if anybody is worried about fractures with impact, I would be very cautious about that and defer to their medical
Yeah,
provider.
take medical
Um,
advice.
yeah, yes.
And something like rebounding, do you think that would really have to be done alongside something like a weight training program for optimal muscle building benefit? Because it doesn't feel like rebounding is going to
Well,
build a lot of muscle.
So rebounding will build more endurance, cardiovascular
Yeah.
endurance and muscle
Yes.
endurance. It's not going to hypertrophy the muscle or really build strength, but it depends, well, past a certain point. It depends where you're starting, right? A sedentary person will absolutely build strength on a rebounder because that is way more
Mhm.
stress to their muscles and to their bones than where they were not doing that. But if you've been rebounding, the thing about the rebounder is the only way we talk about progressive resistance training, the only way to progress the resistance is progress time on the rebounder. So eventually your people are going to cap out. I'm very hesitant to say people need to do this or this because I find that people are
Mm.
most what matters above all is consistency. No matter what it is that
Mhm.
you're doing, you'll get more from a consistent walking program than you will get lifting once a month in the gym. So I'm very hesitant to say do this instead of that. Like I think people should be doing the thing that they will be consistent in doing. So if you love your
That's great
rebounder and you
advice.
feel good doing it, great. But if you're wondering how to optimize, yes, add in a couple days a week or a day a week where you're lifting a heavier load so that you're getting some different types of physical activity in. But if you hear that and you're like, absolutely not, I hate it, then know that you're still doing good for your body by being consistent with
Yeah.
whatever it is that you're doing.
That's cleared up a lot of questions for me, and I think for a lot of people who are watching and listening. Thank you so much for your time today.
Yeah, thank you so much for having me, Claire. I really appreciate it. I am happy to answer questions. If anybody has any more, you're welcome to send them my way.
Well, I hope that conversation left you feeling informed and inspired. Let us know in the comments below. And if it helped you, consider sharing this episode with someone else you feel may benefit from it. As Dr. Becky reminded us, pelvic floor issues are common and most can be greatly improved through the right kind of movement. Whether you're lifting weights, hopping, or rebounding, what matters most is building awareness, coordination, and strength, and doing it consistently. In the description below this episode, just click where it says more. You'll find links to related content on this channel that I think you'll be interested in. And for more information and advice around healthy aging and skincare, head over to my website, honest.scot. Scroll down to the bottom of any page and you can sign up to my newsletter. I'll send you links to all my latest content so you never miss out. But for now, thank you so much for being here today.